Welcome to Transform Now, the podcast brought to you by robotic process automation pioneer Blue Prism. Digital transformation has the potential to reshape the way companies service their customers, engage their employees, and manage their operations. Whether you're looking to develop strategies, tactics, and best practices to positively impact the future of work, or you're curious to learn how other companies have successfully navigated their digital transformation programs, then this podcast is for you. We're here to help you transform now.
Hello, everyone. This is your host, Michael Marchuk, and today on the Transform Now podcast, we have our special guest, Paddy Padmanabhan, author of the book, Healthcare Digital Transformation, How Consumerism, Technology, and Pandemic Are Accelerating the Future. Welcome, Paddy.
Thank you, Michael. It's a pleasure to be here.
I'm glad to have you on here. You are definitely an expert in the field, and I'd like to go into that a little bit more because I think you do have quite a breadth of expertise in the digital transformation within healthcare specifically. So can you tell us a little bit more about yourself?
Sure. So I started my firm, Demo Consulting, back in 2014. Prior to that, I had been in a couple of analytics startups in the healthcare space. And before that, I worked for one of the big four consulting firms. So over the last several years, we've built a business that's focused on helping healthcare organizations with their digital transformation journeys. And what that means is really that as healthcare moves more and more towards a virtual or a hybrid model of care, there's going to be a lot of decisions and choices to make as it relates to priorities, as it relates to technology choices, as it relates to partner selection and partner choices, and the ongoing governance of digital transformation programs to make sure that the enterprises are getting the value that they need. I realized that data and analytics was going to drive the digital health experience of the future. And I also saw that healthcare was going to go more and more online and virtual. And it has turned out to be the case. In fact, in the last couple of years since the pandemic, the pace of acceleration has increased. And I wrote 2 books about it. You referred to the second one, which is Healthcare Digital Transformation, How Consumerism, Technology, and Pandemic Are Accelerating the Future. And the one prior to that is called The Big Unlock, which was about unlocking the value in data and unlocking it through insights that can drive the healthcare experience of the future.
I would say you certainly qualify as an expert in the field. So when we talk about digital transformation, it can mean a lot of different things to different people. So for healthcare providers, can you describe what that should look like?
Yeah, and you're absolutely right. My running joke is that digital is like democracy. You know it when you see it, but then different countries practice democracy in different ways. So it is with digital. Depending on who you talk to, the definitions will vary, especially if you talk to the technology provider community. The definitions tend to be driven by what they offer or what they have developed as a product or a service as a solution. But when you talk to healthcare executives, today, when you talk about digital, they talk about a few big themes. They talk about telehealth. They talk about remote care models, so RPM and so on. They talk about digital front doors, which is really a catch-all term that refers to online engagement with their patients and their consumers. But we tend to take a fairly comprehensive approach to defining digital transformation. We like to look at digital transformation as something that looks not just at the front end, but at the back end as well, through enabling technologies that can improve the healthcare experience for patients as well as for providers. It can improve operating efficiencies and it can improve healthcare outcomes. So it's fairly comprehensive. In fact, we have a 4-stage maturity model that we've developed in the firm, where the 4th stage, which is the highest level of maturity, really defines digital in a very comprehensive way. And within that, we include a lot of themes like automation, data and analytics, and a host of other things.
So you mentioned automation. In your book, you had several really good examples that you went through, but where do you see automation, RPA, providing a positive impact within healthcare?
RPA has been around for a while, and your company is one of the leaders in the space. We see that RPA has made a significant amount of progress in what I call the administrative functions in healthcare. So, what comes to mind when we talk about administrative functions is revenue cycle management, as an example. We are also seeing automation in back-end operations such as IT operations. We are beginning to see automation, specifically when we talk about RPA, slowly coming into the non-clinical aspects of access to care and care delivery. And what we're seeing more recently is that there's a lot of interest in automation, and that is driven in no small part by the acute shortage of healthcare workers, and a shortage that is going to persist and continue into the future. So that's what we see as the landscape for RPA. But when you talk about automation, we are really talking about the competitive landscape in terms of a number of other technologies and platform choices. And we can talk about that a little bit more.
Yeah, actually, I'd like to continue with that thought because we've seen RPA as the base level of automation, but now we're moving towards intelligent automation, which gives you a much broader view of how automation can drive value. Can you talk about that a little bit more?
Yeah, I'm happy to dive into that. My firm does a lot of research on the key emerging technologies that are going to drive healthcare, and automation is one of them. And we actually have a proprietary database that tracks the digital health initiatives of the largest healthcare organizations in the country. And we also track about 400 technology vendors who are enabling the digital transformation of healthcare. And when we look at the platform and we look at the use cases for automation across health systems and health plans, we're seeing RPA being applied in the context of RCN, as I mentioned. We're seeing it being applied in the context of patient flow management. So it could be at the point of access, it could be at the point of discharge. We are seeing RPA being applied in IT support. A lot of operations, IT operations that are routine in nature, are being automated through RPA tools. We're seeing it in contract management. We're seeing it in specific aspects of healthcare operations like prior authorizations, claim processing. We're beginning to see that in patient outreach. We tend to hear about terms like intelligent automation and desktop automation and process automation. These are all various flavors of the broad theme of RPA. But I will also point out that when we hear automation and when we look at the competitive landscape, we're not looking at just RPA, because I believe that RPA providers are not just competing with other RPA providers, they're competing with other technology options. And a couple of examples of those that are playing out in the market today would be voice recognition technology, which has gained ground, especially in the context of doctor-patient encounters and transcribing the encounters into the electronic health record system. We're seeing the growing use of chatbots, for instance, and that has actually grown dramatically over the last year, especially with the COVID-19 screening as a prominent use case. So there are other technologies, NLP, AI. So there are other technologies that we consider to be part of the overall automation landscape. RPA is one of them, and definitely an important one for sure. It's going to gain ground. And the use cases for RPA are mostly today in the administrative space.
I agree, but we're seeing more adoption as we couple these technologies like chatbots, NLP, and AI with RPA to create intelligent automation. Of course, just getting started tends to be one of the most difficult things for any organization looking at transformation. So what approach could you recommend as healthcare providers launch an enterprise-level digital transformation program?
We have a broad framework that we use. It's a 6-stage framework for launching and executing a digital transformation strategy. And it's all in my book. But more specifically, when enterprises are looking to get started, a lot of the leading health systems and healthcare organizations have launched digital transformation programs. They've gotten along in their journey through implementation of some key technologies and key programs and securing board level commitment and board level multi-year budget allocations and all of that good stuff. But a lot of health systems, especially the mid-tier health systems, are still in very early stages. And what we recommend to them is to start by doing a digital maturity assessment. It's based on a 4-stage maturity model that we've developed in my firm that also has an online assessment tool that health systems can take advantage of. They can go and take the assessment, and what we provide them is a benchmark of their maturity levels along 6 different dimensions: digital front doors, inpatient care management, and enterprise technologies, and a couple of others. And we give them the benchmark data to let them know where they stand in the market. And based on the benchmark and based on their maturity assessment, they can make strategic choices about what their priorities need to be. And typically, as part of the work that we do with the health system, we also ask them to look at what their internal stakeholders value. It's one thing to benchmark yourself against your marketplace. It's another thing to really understand what is important for your patient population and for your internal stakeholder groups. So we always ask that you validate the digital maturity and the benchmarking with an internal assessment, and then prioritize your investment. Because at the end of the day, you're not going to be able to do everything on day one. You're going to have to prioritize. You're going to have to commit yourself, and you're going to have to set aside the funds, the internal resources, and a number of other things to make sure you're getting wins. And so that's how we like to get them started. Then once you've got some of these things underway, we recommend very strongly that they put a governance mechanism and a structure in place so that they can keep score and keep track of the progress they're making, keep all the relevant stakeholders involved, make sure that progress is being reported and tracked, and any course corrections that need to be made are being made, and making the right technology partner choices. And very often you may have to make changes to the direction you're headed, either with the technology selection, the partner selection, or even with the priorities that you have started with. So governance becomes very important.
Certainly, there are many ways to assess the maturity of an organization and their readiness for digital transformation, which you've had quite a lot of experience with in the assessments that you've done. Obviously, having the technologies to support the vision is critical, but how often is that the limiting factor? Are there other factors like personnel, leadership, or cultural aspects that affect the digital transformation journey?
It's a great question, Michael. I would say that the technology by itself is not the solution. The technology is a strategic enabler for the transformation, but at the end of the day, it's about changing processes, changing mindsets, changing behaviors. And that is really where, at the heart of it, digital transformation programs succeed or fail. And so we see today that when we talk to our clients, and we did our annual survey of healthcare executives, CIOs, and chief digital officers, and asked them what they thought were the big priorities for the coming year, namely 2022. And we found that one of the biggest challenges for them is to make sure that the technology investments that they've made so far are being leveraged properly, are being adopted, and are being used in the way they were meant to. What we've seen in the wake of the pandemic is that a lot of healthcare organizations have gone and put in technology tools and solutions, and now they're left with a fragmented landscape of technology platforms that don't necessarily talk to one another or to core backend systems like the EHR platforms. And if that situation persists, the users, namely the consumers of healthcare, and also your internal stakeholders like caregivers and providers, are going to see that the lack of seamlessness in the technology platforms is getting in the way of their doing their jobs, or getting in the way of getting the kind of access to care and the treatments that they need. And so they'll stop using it. And this is a big challenge today. And improving the user experience is really at the core of the priorities for healthcare organizations. So, short answer to your question is technology is important and it is the foundation and the strategic enabler, but that's only half the story.
So technology is an enabler, but within the technology landscape, the ecosystem is so large and growing with new players entering the market. How can a healthcare provider make sense of this rapidly changing landscape?
That's a great question. Today, I believe there's more than 5,000 digital health startups out there. And last year, we saw something like $30 billion go into digital health startups. And when I look at the landscape and when I talk to my clients, the first thing they mention is that they're very confused by the landscape. They don't know how to really assess and evaluate many of these startups. They seem to have innovative solutions, they seem to have great ideas, but they just don't know how to assess and evaluate them in the context of onboarding some of these tools and platforms as part of their digital transformation programs. Because there are several risks involved. The platforms may not be mature, they may not be ready, the financial condition of the startup may not be stable, they maybe have raised some VC money, but we don't know whether that's going to continue and what happens 18 months from now if they're not able to gain the kind of traction that their VCs are looking for. They are very often, many of these startups come in without a clear understanding of what it takes to succeed in healthcare. They either have expectations around sales cycles that are misplaced, or they lose sight of some of the core aspects of technology solutions in healthcare, such as data privacy, security, and other compliance-related issues. And so when you look at this landscape, all of these factors contributed to a confusing scenario for healthcare organizations. What we like to tell our healthcare clients is to really understand the attributes of the different technology providers out there. And by understanding their core attributes, determining where they fit within your landscape. So we have a model, it's called the ICEA model, where the I stands for innovators, C stands for custodians, E stands for enablers, and A stands for the assemblers. The custodians are your big transaction platforms like the EHR systems, Epic, Cerner. They have the data, they have the workflow. Every single digital health tool or platform that comes into the environment needs to necessarily interoperate with the backend EHR system for the data. The innovators are the startups that I talked about. There's thousands of them out there, and they all specialize in solving for one problem and try to do it really well. And so that creates a fragmented experience. The platform players like the Microsofts, the Salesforces of the world, they are trying to solve for that by creating a fully integrated platform that can be configured and customized and interoperate with your electronic health record systems. But to do that, you need the assemblers, where the big consulting firms, the systems integrators will come and take all of these different platforms and stitch them all together. And very often they bring the capabilities to design the user experiences in order to make it seamless as well. So for a healthcare executive, it's important to understand what the core attributes of a particular technology provider are. And based on those attributes, you engage with them for the appropriate solution. That's easier said than done, because a lot of the players want to appear to be more than what they really are. And electronic health record vendors, for instance, they want to be everything. They want to be your digital front door. They want to be your digital platform of the future. But we know that EHR platforms are not your first go-to if you want to, let's say, select a CRR platform, as an example. Or for that matter, EHR platforms are not best in class at everything that they do. And there is a number of standalone companies, startups in particular, that have developed standalone best-in-class tools for specific functionalities that increasingly healthcare organizations are turning to. And none of these product companies has a big professional services group anyway. So if you need a systems integrator to come in and do the work, you don't go to a product or a platform vendor, you go to an SI partner. So you need to understand, now the SI partners, some of them are building products, so they were acquiring products. So they're coming over into other spaces, but you really need to understand what their core attributes are and engage with them appropriately. Otherwise, you'll end up picking the wrong vendor for the wrong solution and setting up yourself as well as your partner for failure. Building the seamless experience for the user is what is going to drive all of your platform choices and your partner selection choices. If you cannot achieve that end goal, then all of your investments are basically not going to come to fruition.
Yeah, well, I can certainly understand that. So we've talked through a lot, and I want to find out from you, what takeaways would you recommend for healthcare providers that are currently engaged in a digital transformation journey right now?
I think what healthcare organizations need to do is really, firstly, have a good pulse of what is going on within their peer community of other healthcare organizations. What kind of programs have other organizations implemented? What have been the successes? And importantly, what have been the challenges and failures as well? And through that interaction, and you either get that directly through your network or you use a firm like ours that can actually deliver some of that information to you, or whatever the means may be. And once you're familiar with what is going on in the rest of the landscape, then you can align your priorities and your goals appropriately. Then understand, what are the best practices and the challenges and constraints. Today, as I mentioned earlier in this conversation, there is a huge talent shortage today. So leading from that, I would urge healthcare executives to look at where they can deploy automation technologies to alleviate their talent shortage problem. I was reading a report, I think it was by the Mercer Group, which talked about the emerging talent crisis in that category of worker, which is at the front lines, not necessarily at executive level, but the front lines of care. There's about 10 million workers in that. We're talking nurse assistants and home healthcare workers in that space. And I was reading that report, and it said that about 5 million of them are going to leave the workforce in the next 5 years. And it's going to create a huge shortfall because those roles are not going to be filled up anytime soon. And a lot of people are voluntarily leaving healthcare because of the burnout and the workloads and everything, especially since the pandemic. And it's unfortunate, but true. So you have to necessarily turn to technology-led solutions to alleviate the problem. And one of those is automation. So I would urge healthcare executives to look at technology as strategic enablers to set yourself up for a future of digital health where a lot of the work is going to be done through automation, but not taking away from the highly personal experience of healthcare services.
Wow, Paddy, this has been extremely informative. I am going to leave a link to your book. Again, the title is Healthcare Digital Transformation, How Consumerism, Technology, and Pandemic Are Accelerating the Future. It's in the show notes of the podcast so that folks who are looking to get this can go on Amazon and pick up their own copy. There is so much more information in this book. It's amazing. So I highly recommend, if you're involved in healthcare digital transformation, Paddy's book is very comprehensive and he does a great job of outlining the issues as well as some of the solutions around us. So Paddy, thank you so much for joining us today.
Thank you so much, Mike. It was very to share your comments. And I look forward to following your work as well and the work of your company, and all the very best.
Thank you.
Thanks for tuning in to Transform Now. For more insightful discussions on digital transformation and more, check out our podcast channel where you'll find all of our previous episodes. To make sure you never miss an episode, subscribe to the show on your favorite podcast player. And if you like what you heard, please leave us a review. For more information about digital transformation and the future of work, check out blueprism.com to learn how Blue Prism's digital workforce is enabling enterprise transformation now.